Hi, welcome once again to Healthcare Hoax Videos. I'm Janet Cimorelli. I'm here with Dr. Herb Slavin, and today we're talking about solutions. Solutions to your headache issues. So you know that you don't have to be looking for the next non-steroidal anti-inflammatory drug. You don't need to be seeing your physician for a prescription. By identifying the underlying causes, by knowing what the symptoms are, by doing the proper testing, you can come to the right solutions. So Dr. Slavin, when you see someone who's dealing with chronic headaches, what might be your first line of suggestion? After you've been through the testing and after you've been through a discussion with the patient, what are some of the things that you think can help them?
Well, I'd first like to remind everybody there's no such thing as a drug deficiency. So when you reached for those over-the-counter products to treat your headache, of course we got into digestive disturbance that could trigger a headache, and have another whole row of products over-the-counter for that. You know, you're just covering up the underlying cause. So if you ask me, where would I look first to try and address the problem? Of course, we've done all these testings, and we've looked at hormones, we've looked at nutrient deficiency, so you correct all those things. So after that, I would tell you to read the labels of everything you're eating, because all these hidden ingredients, they're a very common cause of headaches. So that would be one area. And we mentioned earlier about caffeine withdrawal. Pay attention to the timing of your headaches. If it's coming on in the early morning hours, you wake up with a headache, it could be caffeine withdrawal. So those are the areas. Look for the hidden ingredients in foods and perhaps caffeine withdrawal.
What about suggesting, if someone has a food sensitivity, to begin work on their digestive systems and use very high quality digestive enzymes and probiotics? Might that be in an area that you'd work with patients?
I think the probiotics are very important because they're essential to good health, and they're going to keep the unwanted bacteria and yeast under control as long as you supply enough of the friendly bacteria. So I think that's an important point. Digestive enzymes may be important, but I think the most important thing is making good choices for the foods you're eating. That's probably the most important. You go to these fast food places, I'm pretty sure they're using MSG in their food to enhance the flavor of their food. But they don't give you, I don't think, the ingredients that you're eating, so you would never know. So what do you do in that case? Avoid it for a couple of days, and if your symptoms clear up,
Wow.
That will help you make the diagnosis.
Okay, years ago there was a gentleman who ate nothing but McDonald's breakfast, lunch, and dinner, and the conclusion after his test period was that his health had dramatically suffered. His digestive system had literally been torn apart. So I guess that what you're saying about hidden ingredients or unnatural ingredients that you might not necessarily want to be exposed to on a regular basis, that's critically important advice.
You've heard of what they used to call the Chinese restaurant syndrome?
Oh, yes, yes,
right?
yes.
You cause a stiff neck or headaches. It's the MSG, and I think nowadays when you go to a Chinese restaurant, many of them will say we do not use MSG. And if they don't say it, you should inquire about it, and maybe they can keep it out of your food.
One of the areas that I think is so helpful because of its anti-inflammatory benefit, because of its circulatory benefit, I'm talking about omega fatty acids. What do you think about using those supplementally for someone who's dealing with headaches, chronic headaches?
If someone is deficient, and I would say that, because we test everybody for omega-3s, and unless you're taking omega-3 supplements, you're going to be deficient. So I would say take the different nutrients to allow the body to function optimally. So if you're lacking omega-3s, it's going to impair the body's ability to function properly and or respond to any challenges that might trigger a problem, but you couldn't, the body can't respond because it's lacking the omega-3s.
So it does come down to you are what you eat, and you certainly are what nutrients you absorb. And I hope this series of informative videos has been helpful for any of you who are dealing with headaches, any friends and family who might be having on a regular basis headaches that are debilitating, that interfere with your function over the course of the days and weeks. And that's what we're about here on Healthcare Hoax videos, giving you the information about a variety of relatively common health challenges and giving you literally a recipe for moving through that challenge and identifying causes and recognizing symptoms, then doing the right testing and finding solutions for your health issue. Healthcare Hoax videos, I hope you go to healthcarehoaxvideos.com and like us and share the videos with your family and friends. If you subscribe, then we'll send you a notification when the next Healthcare Hoax video is posted. Thanks so much. Until next time.